Sir is a distinguished figure with over 3 decades of experience spanning administration, higher education, scientific research, and institutional governance. Renowned as a distinguished academician and fervent researcher, he remains dedicated to propelling Ayurveda into new realms of innovation. He has various awards and accolades to his name, and for his outstanding contribution to the field of Ayurveda, he was awarded Padma Shri, the fourth highest civilian award in 2015. I welcome you, sir, and hand over the mic to you for taking the session forward. Thank you.
Thank you. Thank you for inviting me. For this session, we have four distinguished experts, and I would like to invite them on the stage to take this session forward. First, I invite Ms. Phyllis Kim. Ms. Kim, please come. Ms. Kim is a public health practitioner who has dedicated 2 decades of her career to designing and implementing public health and education programs in low and low middle income countries. She has extensive experience developing innovative frameworks, plans, and solutions for both private and public development institutions, informing policies and programs. She earlier served as a senior technical advisor and project director of a multi-million-dollar public health programs implemented across 14 countries. She currently works in the health, nutrition, and population global practice at the World Bank, supporting countries as they work to achieve universal health coverage and respond to the health emergencies. Welcome, Ms. Kim, and you are a senior health specialist and behavioral scientist. Next, Ms. Neelam Makijani, please come. Neelam ji, she is a country director of Management Sciences for Health. She is a results-driven professional with over 2 decades of leadership experience across development sectors and geographies. At MSH, she is committed to creating a world where everyone has the opportunity for a healthy life. She has worked in the US, UK, India, networked and supported development sector in over 30 countries in Asia and Africa, forging strategic alliances, effective communication and resource development, works side by side with public, private and community partners at all levels of the health system. Prior to joining MSH in 2022, Neelam was the country director for Child Fund International for India and Sri Lanka, where she served for 8 years. Welcome, Ms. Neelam Makijani. Now I invite Sri Rajiv Vasudevan. Rajiv Vasudevan is a founder of the first and only National Quality Award winner Ayurveda Sector Hospital, known as Ayurveda Hospitals. There are 3 hospitals that are NABH accredited and 1 that is JCI accredited. Apollo Ayurveda is a pioneer and leader in quality systems driven precision Ayurveda medical care rendered through a model of integrative care in partnership with leading quaternary care hospitals across the country. He is also a member of various national technical committees and expert groups of Ministry of Ayush, Niti Aayog, CII, as well as select state governments and industry in India. He is a very good friend of mine. We are working together since so many years. I also invite Dr. C.V. Jaidevan. Dr. Jaidevan is my senior at Jamnagar, so he's a boss. Professor Jaidevan has over 34 years of teaching experience and guided dissertations in the field of learning disability, developmental disorders, speech disorders, autism, scholastic disorders, alcoholism, etc. He has been on the boards of various prominent Ayurveda institutes, universities, and technical bodies like Institute of Teaching and Research in Jamnagar, in Ayurveda Jamnagar. This is the first institute of national importance in the country. And then also National Institute of Ayurveda, Jaipur, which is a deemed university. He is also associated with Clinical Research Institute for Yoga and Ayurveda and Center for Integrated Management of Children with Differential Abilities at Kottakkal, Public Health Initiative Schemes and Central Council for Research in Ayurveda and Siddha, Ministry of Ayush, New Delhi. I welcome Dr. Jaydevan, Sri Rajiv Vasudevan ji, Ms. Neelam ji, and Ms. Kim. Thank you so much. And now to take this session forward, I think I would now first invite Ms. Kim. I think Ms. Kim is first. So Ms. Kim, would you mind to come?
Thank you. Hopefully everyone is revived from their caffeine break. Good afternoon, everyone. Sorry, just pushing this back a little bit. It's an honor to be here with you today. My name's Phyllis Kim. As mentioned earlier, I'm a senior health specialist and behavioral scientist with the World Bank. Today, I'll be speaking about the global perspective on providing better quality health services. There we go. Specifically, I'll be speaking about disease burden and transition, both globally as well as here in India, trends in the future of healthcare, as well as providing better quality healthcare services in a changing world. We'll start with a quick glimpse of the global burden of disease and transition, as well as trends occurring here in India. Here on these maps, you'll see the distribution of burden of both mortality and morbidity around the world showed in DALYs per 100,000 people of the population. We see rates across regions with the best health being below 20,000 DALYs per 100,000 individuals. By 2019, you'll see that this has been achieved in most European countries, as well as Canada, Australia, Kuwait, Taiwan, Japan, South Korea, as well as Israel. You'll see that in India, I have marked both what the DALY was in 1990 as well as 2019. You'll see that the DALY has changed from about 66,000 per 100,000 in 1990 to 38,000 per 100,000 by 2019. At a global level, in 2019, more than 64% of the burden of disease resulted from non-communicable diseases, with 26% from communicable maternal, neonatal, and nutritional diseases, and 10% from injuries. The chart here shows a notable shift since 1990, when communicable diseases held the highest share at 46%. This shift in burden towards NCDs is a result from a significant reduction in communicable as well as preventable diseases as income rises and overall health and living standards improve. In India, you'll see that in 2019, 58% of the burden of diseases results from NCDs, up from 29% in 1990, which represents a relative change of 73%. Here we'll see the breakdown of disease burden by cause and absolute numbers of DALYs by cause. You will see the non-communicable diseases are shown in blue. In red, you'll see communicable maternal, neonatal, and nutritional diseases. And in gray, you'll see injuries. The breakdown of disease burden by cause varies by country. In India, you'll see where the rate of communicable diseases is on the decline. India is still faced with a double burden of disease from communicable and non-communicable diseases. While the largest burden in 2019 comes from cardiovascular diseases, the fourth being respiratory and the fifth being cancers, the second and third are neonatal disorders and respiratory infections and TB. In the two charts here, we see the breakdown of total disease burden by age group from 1990 onwards. This is shown as the relative breakdown of total disease burden and by the rate of burden per 100,000 individuals within a given age group. Sorry, there's a lot of feedback up here. Overall, we see continued decline in health burden in children under 5 years of age, both in relative terms, falling as a share of the total by more than half, from 41% in 1990 to under 20% in 2019, and in rates per 100,000 falling more than 50% from over 160,000 to less than half in 2019. Nonetheless, both globally as well in India, you see that the rate of disease burden remains highest in the youngest and oldest in society. Daily rates in under 5 and those over 70 remain significantly higher than other age groups, and they have seen the most notable declines in recent decades. Additionally, at the global level and in India, collective rates across all ages have been in steadily decline. This shows that health has improved considerably over the course of the last generation. In this slide, you'll see the burden of disease by risk factor and how risk factors affect 20 broad cause groups noted on the right. Behavioral, which include things such as alcohol, drug, and tobacco use, malnutrition, dietary risks, as well as low physical activity, account for over 800 million DALYs, or about a third of all DALYs here in India. The environmental, which include things such as non-optimal temperature, air pollution, and wash, are the cause of over 450 million DALYs, accounting for just under 19%. And the metabolic is the cause for 400 million DALYs, which is just over 16% of all DALYs. So looking at the trends in the future of healthcare, and what that may look like, the transformation occurring in the health sector is quite existential right now, with patient-centered healthcare that embraces new medical and health discoveries, the integration of one separate disciplines, and expanded understanding of what is necessary to live well. You see, the transition is into a system that is centered on the patient, focused on virtual and in-home treatments, and linked closely to outpatient care. It's characterized by the democratization of healthcare and a culture of the transformation in delivery and perception of health. It's driven by data and analytics and will provide value while embracing transparency and interoperability. Enabled by cross-cutting medical technologies, it will become an integrated system. It will also be characterized by rapid technological advances not seen in a generation. This figure here shows key areas of expansion that are already underway. These trends represent only a glimpse of the mushrooming field of digital technology in health. One of the many areas of rapid advancement is generative AI, which I will skip over this slide. As we heard in our last session, quite a detailed presentation from Niramai that describes the AI in detail. But the point in highlighting this is that AI is changing everything. As health systems undergo this next wave of transformation to reduce inefficient processes incrementally and deliver new, better, and seamless services, technology and data will be an integral part of that process. But technology will not drive the change. It will support, augment, and accelerate the changes that systems are already undergoing. So the key question here for decision makers is how to maximize the benefits of technological innovations to strengthen the entire health system and advance towards UHC. AI will play a significant role in aiding clinical decision-making by analyzing vast amounts of data to identify patterns and trends. Here you'll see, sorry, I'm just making sure we're on the right side. You'll see, earlier in my presentation, I highlighted cancer as the 5th largest disease burden in India. And again, as I mentioned, while there's many technologies that are advancing healthcare as we know it, I'm highlighting AI here today as a cost-effective way to address low cancer screenings here in Gujarat, as well as other parts of India. Here you'll see a randomized control trial comparing AI and radiologists in Sweden. This was funded by the Swedish Cancer Society as well as the Swedish government. But here you see the results of the randomized control trial with standard double reading by radiologists that concluded that AI-based breast cancer screening is not only safe, it reduced the screen reading workload of radiologists by 44.3%, which is pretty substantial. So now we'll go into talking about providing better quality healthcare services in a changing world. As mentioned earlier, this change has been accelerated by disruptions in the COVID-19 pandemic. The weaknesses and strengths have all been identified, and it's essential for health systems now to prepare, adapt, and respond to everyday and extraordinary challenges and stressors such as climate change, emerging infectious diseases, the shifts towards NCDs, as well as conflict. So here you'll see that there is a wider transformation of health systems that we are currently undergoing. We know that currently our health systems deliver services mostly at health facilities, where mostly people who are going there are already sick and receiving reactive care. But looking towards the future, we see that health will be much more personal, not only to what I need and you need, but also where I live as well as where you live. We will have long, continuous care with stronger emphasis on proactive and preventive care. So now I'll go a little bit into social and behavior change. Given this transformation of the health system, along with the disease burden shift and challenges India is facing with issues such as high anemia rates and NCDs, I'm highlighting social behavior change programming as an approach that will be particularly important in India to strengthen health systems and to help achieve universal health coverage. Here you'll see what SBC is and how the interventions include trust, power inequalities, neighborhoods, improve the quality of health services, particularly in poor and low-income countries. And I'm noting this because if you recall earlier in my presentation, I noted that behavioral risk factors accounted for over 800 million, or a third of the total DALYs here in India. Which brings me to my next slide of how important it is for medical technologies and innovations that can be used to advance social behavior change interventions in support of health systems strengthening and achieving universal health coverage. Not only will it do so by empowering individuals to take an active role in improving their health behaviors and outcomes by arming them with their own health data, it'll help enhance the provision of equitable, high-quality care, help health system and policymakers and other stakeholders understand, monitor, and act upon changing population health beliefs, knowledge, and needs, which we saw incredibly important during COVID, and contribute to changing behaviors at scale. Here you'll see some examples of medical technologies that have been used to improve NCD service delivery and health outcomes, as well as cost efficiency. On the left, you'll see the program names. In the middle, the solution and a description of how the technology was used. And on the right, the impact of implementation of these technologies had in the health sector. For example, in Mexico, you'll see an NCD prevention and disease management program that increased A1C testing in diabetic patients from 10% to 54.8% in participating clinics. In Brazil, we see tracking and transmission of biometric data with a personal device, such as blood glucose levels and blood pressure, from chronic patients to medical professionals, reduce hospital emergency ward visits by 2/3, and that over 80% monitored adhered to their treatment plan. So these are just a few examples of how MedTech can be leveraged to empower individuals to change their behaviors and achieve better health outcomes simply by providing them access to their own health data. So in summary, just some key takeaways to keep in mind. Globally, there has been a notable shift in the burden of disease, as I mentioned earlier, from communicable, holding the highest share in 1990 at 46%, to NCDs, holding the highest share in 2019 at 64%. In India, where there is a double burden of disease of both chronic and non-communicable diseases, you'll see that the burden of disease from NCDs in 2019 is up at 58%, which is up from 29% in 1990. That's a relative change of 73%. In India, behavioral risk factors account for over 800 million DALYs, about a third of all DALYs, which is substantial because, again, if we're thinking about behavior change, that's a very, it's very long-term, but a huge part of what we need to be changing in terms of making a difference in health outcomes. COVID-19 has accelerated the existential transformation occurring in the health sector. The future of the health sector is going to be much more patient-centered as well as technology-driven. And private sector investments will be a key to providing better quality healthcare services through increased demand for and access to healthcare. And that's it. Thank you.
Thank you, Ms. Kim. It was a wonderful talk, and then you were able to cover a lot of different things from different perspectives and providing and offering a solution for holistic healthcare. And you did actually detail with a lot of documentation, documentary evidences about how it is effective. So thank you so much. And now I invite Ms. Neelam Makijani. Uh, Her topic is holistic healthcare systems and financing. So it's very interesting. It's a different perspective of the same topic. So
I
please.
hope so. Thank you, and good afternoon, everyone. Good afternoon. I am really sorry. I think you're killing you. You know, you call this killing by PowerPoint, and I think we are doing this to you since the morning. So my apologies. Couple more to go, but I'm really excited to be here. And as Sir said, I'm going to talk about holistic health, of course. That's the topic given to me, but there are more questions in my presentation than answers. And because I am very aware that the holistic wisdom in this room is much greater than what I know. So I'm going to leave you with a lot of thought-provoking questions, and then we can discuss them later as we go. So very quickly, okay, where's that? So a little bit, just a word about my organization, Management Sciences for Health. I'm representing the organization and the work. We are a global organization, and as you can see on the screen, we are working in over 30 countries as I speak. And the whole focus and the mission and the vision of the organization is to ensure that there are strong, effective, and efficient healthcare systems. So we are a non-profit in the US. We are an Indian organization as well. The focus primarily is on ensuring that systems work. We do a lot of supply chain work. We do a lot of system strengthening working with the government. So it has been a lot. That's why I wanted to focus my conversation on systems and financing. And of course, you know, we keep saying we'll do all of this, we'll change the world, but somebody has to ask who's going to pay for it. So that's what I wanted to also cover a little bit. So what I'm going to talk about today, of course, I'm going to define health again, because as I am learning this whole genera, it's like it's defined differently. So what does holistic health mean as well? And then what approaches we could be taking if that is going to become the norm of Indian healthcare system. There are lots and lots of foundations already in place. We saw the video in the morning with the Honorable Chief Minister. Gujarat has shown a lot of pathway, a lot of work that's already done, and I think it's true for across India. What would be the impact of holistic healthcare if that became the integrated part of offering care? So I'm going to just go through that. And like I said, I will leave you with a lot more to think about. And then we can obviously look at these later on. So my next slide. So there are a couple of definitions I found. If you talk about health, holistic health, the WHO defines it as a complete physical, mental, and a social well-being of a person. That's how WHO would say it. Krush says it's about equilibrium. It's about Pidosha, Agni, and Dhatu. We all know this again. The elements that form our body, but how do we bring them together? That's another concept and perspective of health. And the last one, of course, which is we all also know quite well, is the traditional Chinese medicine, which is a state of balance and harmony within an individual and along with the individual with its nature, so where its existence is. So these were simple things. Now, they sound simple individually, but if you bring them together, what does it mean in terms of holistic health? So this is something we did steal it from the Google Master. So this was how we saw it as well. So if you look at it, look at the outer circle. I think it covers holistically what we do. So the bottom half of the circle talks about our lifestyle, which is why we need this holistic health as a very important step forward. Our lifestyle, the stresses, the counseling in the mind and the body, and the balancing of work balance, and et cetera, that we talk about all the time. So, and then on the left and the right on the right, of course, of my right, is what we are doing conventional medicine. And on the left, of course, then what supports both of them. So that's how we see it. If we had to look at and consider holistic health, then we would have to look at it in the way that we combine all these elements together. How will that integration work? Some examples. I think Phyllis did talk about some, but let me give you a couple more examples in that sense as to what's happening globally. Phyllis did an amazing round the world for us, but let me just point out a couple more. So as we know, the Chinese medicine, comprehensive medicine is more about integrated into, it's integrated, it's very well integrated. The conventional and the traditional are well integrated. Africa looks at herbal use a lot more than others. Switzerland, again, they've taken Ayurveda on, and Malaysia, Singapore allows medical, other practices. So I think this is an exact example. If you look at the bottom three boxes, which talk about Korea and Japan, now China is already integrated. Korea is excluding the two, the convention, the traditional, and the rest. And Japan is, the traditional is subjugated. I think India sits somewhere between Korea and Japan. We have it. We're not sure, so I'm getting a couple of nods here, so thank you. So India sits somewhere between the two countries, Korea and Japan. The next couple of slides that I will talk about is, what would it take to integrate it and set a right precedence going forward? I believe for any project, not just holistic health, but whatever that we tend to do and we wish to succeed in, we must have the systems in place, we must have the people with the capacities to do that. And of course, no one can do it alone. I heard it in another session earlier today. No one sector, no one company, not even the government itself, can just make sure that everything works. We do need to work with each other. Collaborations will become the norm going forward. And it's always, as the saying goes, you want to walk fast, walk alone. You want to walk longer, further, go together. And I think holistic healthcare concept is about walking the long distance. So who do we see as the stakeholders in this whole process? We look at multiple ministries, of course. I'm sure you will all agree. It cannot be just the health. It will require finance ministries, the health, the tribal, the Ayush mission, of course, will lead the way for it. But it will require a lot of support from all the ministries to think the answers together. Multiple industries. We've seen an example since morning. I mean, we've got a very varied and diverse speakers since the morning. So we are looking at how do we bring industries together, associations, sectors, academia. Of course, again, we heard academia as well. We even heard startups. So I think this is where it says multiple sectors, public, private bodies. NGOs, of course, we've got over 3 million NGOs in India. You can't ignore them. I come from that sector. And they are the movers and shakers and can be the biggest ammunition for us in terms of community work. And when Phyllis was talking about behavioral change, it happens at the community level. And you do need to look at, you need to look at how the nonprofit sector can support those connections. And then systems of medicine, which we talked about already. So holistic health will require us, all of us, to work together. And still, so what would be the implementing structure? Stewardship. I think in India, we've seen that. TB, for example, we are implementing a project that is supported by USAID, which is Health Systems for TB. And TB has seen a lot of resources, lots of commitment that's gone in. We've got leadership from the TB sector sitting here. And that's because the Prime Minister announced elimination of TB by 2025. There's a huge amount of commitment, movement, pace, everything to it, and resource allocation for it. So we do need the stewardship if this is going to work. And it has to come from the highest level. We need systems, capacities in place. We need to do integration of multi-stakeholders, as I just said, create steering groups that can work together and come up with recommendations, and of course financing. Like I said, who's going to pay for it? The traditional ways of financing are difficult. In today's world, a small non-profit organization, if they're going to only depend on traditional ways of financing, is finding it hard to survive. So where are those innovative financing mechanisms going to come from? In our project, Health Systems for TB, we are introducing new ways of financing the TB world. We are introducing new ways of bringing in multiple sectors to fund the elimination of the TB program. So it's corporates, it's financing, it's capitalist, it's venture capitalist. You have to look at it in a very, very different way. So those financing mechanisms, resource generation, and I think this is also very important. How will you sustain what you build? How is it going to continue to fund itself what you piloted initially? And Global Fund and very big organizations do come in place. TB is a classic example. The initial funding for bringing in private sector in TB was from outside. Then the government found it very lucrative, and now it's all domestically funded. Not all, partly. It's domestically funded. So that's a big applause for the government to take that on. And I think that shows the path, and that's how I think all of the initiatives that we want to sustain in India will have to be domestically funded in partnership with other players. And that would be your resource generation strategy as well. So my questions now, I'm going to come to questions. Enough of the gyan around here. But the questions, so these are some of the systems that are already in place. In 2005, NRHM was established, now NHM. In 2011, the Ayush Mission was established. Ayush Mission is focusing a lot on education. It is focusing a lot on service delivery, R&D, all the areas that are required for any initiative to succeed and to grow and to scale. In a diverse country like India, where disparities are known, how is it that is going to reach that last mile person? So we have to look at, and then how does all of this align with the concept of holistic health? How does it align? How do they support? We have excellent foundations in place. But service delivery, I think, is something that we need to focus a lot more on. And how will Ayush Mission therefore take the lead on this, on aligning the foundations, using and leveraging the foundations that are already in place? So I think that becomes really, really important to answer. So considerations for the wisdom in the room and my colleagues on the panel. So what policies do we need to have in place to facilitate this action to become a force? And do we have any existing structures that can be leveraged? What are the relationships we already have that need to be leveraged and therefore can be scaled? And lastly, but not to the least of it, is the resource generation that I'm saying so much about. It's costing a lot. My organization has now worked with NHSRC in Delhi to do some work on what health budget for universal healthcare budget for the next 7 years. And yes, the non-communicable disease came out to be on top of it. So we are already doing budgets for the next 7 years. And how are we going to integrate the needs of holistic health in that? And I think that would be a very important question to answer. So just to therefore share where our thinking comes from, as I said, I represent Management Sciences for Health. Our thinking comes from the fact that my organization's strategy is based on localization, unlocking the potential, mobilizing resources, and demonstrating impact through evidence. This is my organization's strategy, and the questions that I just posed to you, I think there are some answers in the strategy that my organization is working on. How, therefore, do we go into developing countries, in the countries that need a lot more help? But in every country that MSH is working in, this strategy works. Local ownership, and I know this as well, and so do you. I've heard this so many times. Every time we have a conversation, we say health is a state subject. So if it is a state subject, where will the ownership come from for these things? Where will the resources come from? How are we going to get the ownership of the locals, local leadership, and the local people towards this? So I just wanted to align the thinking that I've shared with you with the strategy of my organization, and we'll be very happy to be part of the thinking process. And we believe in diversity, equity, and inclusion, most importantly, creating evidence. So that's I think these form the foundation. My organization works on these foundations, and so very happy to be here. And thank you so much. Thank you for listening. Thank you.
Thank you, Ms. Neelam. as you mentioned that I will be putting some thoughts for the food for thoughts, maybe for consideration, for more discussion. And, and you actually did well, and then, a lot of questions probably have been generated through your talk, and we'll discuss those things at the end, So what I'm proposing to the august audience, that first we listen to all four experts, and then we will open for the discussion. So now I invite Sri Dr. C.V. Jaidevan, Professor Jaidevan. As I mentioned, he's a very good friend, my senior at my institute at Jamnagar, and he will be speaking on mainstreaming of Ayush and perspective wellness.
Good evening. Respected Chairman of the session, Dr. Vaidya Rajesh Kutteja ji, my co-panelists, and friends. I think all are very exhausted, tired. The topic given to me is mainstreaming of Ayush, evidence-based integration. So there are 3 points. One is mainstreaming of Ayush, another is evidence-based integration, and thirdly, I'll try to have a SWOT analysis for strength, weakness, the opportunities, and threats in this integration. So in this mainstreaming Ayush, I think first we have to define Ayush, define the health and the holistic health. I think my previous speaker has already covered this topic. See, these are the 3 things in front of us. We have a glorious past. We say that we can cure many diseases, or say before 50 years, we managed every conditions in Ayurveda or other traditional medicines only. Now we have a very realistic present. We need to be very realistic, because there is a tendency to claim that we can cure all the diseases. It is not like that. We have limitations. So we have to understand our limitations. And of course, we have a very good potential future. So for this, let us see, so what are the challenges? One main thing is we have a tradition beating modernity. What we have practiced is on traditional lines. But our needs, now the world has changed. Now we need a modern approach. And also, our resources are very local. We have only local resources, but we are not able to meet the global needs. That are the few challenges. And also, recently the regulatory frameworks are getting strengthened, and also the regulatory bodies like National Commission for NCSM, they are taking a lot of steps for rigorous quality control in education. And the curriculum revision is, thorough revision is going on. And the public awareness, I think, after COVID, it is enhanced. And also the Global Center for Traditional Medicine, which is coming up in Jamnagar. I think it has really made a lot of changes. It has given some global recognition and collaborations. And I think these are the main things which we should consider while talking about integration. These are the potentials of integration. Our main potential is the holistic approach. That is physical, mental, social, and spiritual aspect is covered in this approach. We have been preaching about this holistic. Now I'm happy that this has been a discussion, it's a topic of discussion, because mainly in Ayurveda we generally always speak about holistic approach and wellness. And after some 30, 40 years, now it has come to the mainstream. And a discussion like this in the Vibrant Gujarat platform, we are speaking about the holistic approach. So we are very happy to see this change. And also, we have a very rich cultural heritage, because it's very deep-rooted in India. And we have the potential to integrate, to come to the mainstream. When we say mainstream, coming to the mainstream, it really means that we are not in the mainstream now. We were in the mainstream in the past, now we have to come to mainstream. So I'll skip some of the slides. Yes, we'll talk about evidence-based. Why evidence-based? Why we should be evidence? It should be evidence-based. One is a scientific validity. And examining the evidence base of Ayurveda. I think this is a very controversial subject among the Ayurvedic people, because many people say that we need not go for such evidence-based practices because it is already clinically proved, and we have our own tools. And why should we go for modern tools and scientific tools? Maybe it is not fit for Ayurveda. There are many such arguments. But I think basically to make it global, we should be to examine the evidence base of Ayurveda. So there is need of scientific validity. And clinical efficacy is definitely, it's a the crucial point, because, and finally, the result is important. It has to be clinically, we have to prove. We have to show the result. And patient safety is another concern. And integration other wisdoms, streams really means the bridging the gap. And the comprehensive, the wellness concept is also is a key point when we talk about the evidence base. Standardization of practice is a very urgent need. We need reliable protocols. Global acceptance is a very important point, promoting Ayurveda with credible scientific support. Chronic disease management, leveraging Ayurvedic approaches with strong evidences, and personalized medicine, tailoring Ayurvedic treatment based on robust evidence, and educational advancement that is shaping future of Ayurveda, because education is the most important thing, because the future of Ayurveda depends upon the education of Ayurveda. And methods to become evidence-based is rigorous clinical research to assess the safety and efficacy. Observational studies, we need observational studies to understand the real-world impact, sustained effects, and potential risks. Systemic reviews and meta-analysis for aggregating the existing research, and also standardization of Ayurvedic formulations. Methods to become evidence-based, there are a few more points, like integration with advanced diagnostics, collaboration with conventional medicine, adherence to research ethics, and patient-reported outcomes, and long-term follow-up studies. I'll end up with a short analysis, very few points. I'll take only some 2 or 3 minutes. Our strengths, weakness, opportunities, and threats. Our threats, main strength is our approach, the holistic approach. And another important point is a time-tested practice, because it is practiced for thousands of years in India. And rich pharmacopoeia. So there is a range of plants and plant-based products we have. And the mind-body connection, it's already mentioned here, is acknowledging the emotional and mental well-being. And focus on root causes, importance to lifestyle modification, etc. And growing research base, exploring the safety and efficacy are also very important. These are our strength of why we should go for, when we go for integration, I think these are the strength. The weakness, lack of standardization of practice and products, leading to variability in practice. Every physician claim in their own way. We do the basti, anyone like a procedure, and with the different equations, different quantity, and she says that what I practice is correct, my practice is correct because I get result, but it is not standardized. Subjectivity in diagnosis, and also in limited understanding of mechanisms. We are not able to explain the mode of action many times, how it acts. So, and safety concerns, and also the cultural and geographical variations, also resistance to change. Still, there are sentiments towards Ayurveda. There are people who are still not ready to change. When you talk about Ayurveda, we become very sentimental. That is not very good. For a scientific world, it is not very good to be sentiments. There is no need of sentiments in science. These are the opportunities. Collaborative research initiatives and fundings like CCRIS and Ayush and EMR projects there are so many projects coming up. Integration into academic curricula, PG Star, Spark, and there are many such projects coming up, funded by central government. Of course, all these are from the central government only. Regulatory support, and also the technology integration, diagnostic, data analytics, telemedicine, etc. Global collaborations like Global Center for Traditional Medicine in Jamnagar. These are the opportunities like public awareness and acceptance, Ayurveda Day, International Yoga Day, etc. There are so many schemes. I think these are only very I listed only few because there are a lot of initiatives by the central government, thanks to Dr. Rajesh Kotecha ji and his team for promoting Ayurveda globally. And I should say that this is the golden period of Ayurveda, golden period of Ayush in India. And these are some of the threats. Commercialization is a threat. Global variability in practice is a threat. Misinformation and overgeneralization is also dangerous. And lack of standard tools and protocols are also a threat. Limited research infrastructure at the timing is also our limitations. Skepticism from scientific community regarding rigor of Ayurvedic research is also an important threat. So there are some problems in integration. And let me conclude by saying that the best is yet to come. We are included in the, I'm very proud to say that we are included in the Ayushman Bharat Digital Mission. All India Institute of Ayurveda is a very important initiative by Ayush. It's a very successfully running, and also there is a new center at Goa. And CCRIS has totally changed. The research organization structure is totally changed, and new initiatives are coming up. And talk about NCSM, the education sector, a lot of reforms are initiated. And WHO collaborations you can see, and there are institutions like PCAMH. And also you see Jamnagar, it was a PG center, now it is converted as an institute of national importance. And Jaipur, now its NIA has been converted to deemed university. And I must say something about National Ayush Mission before I wind up, because there are a lot of centers have been converted into wellness centers. There, for the last 5 years, there is a lot of transformation is happening. And all these are initiated by the central government and the Ayush department. And I'm very proud to stand before you as a postgraduate from Gujarat Ayurveda University, Jamnagar. I have done my post-graduation in 87 to 90 period. I have seen the growth, I have seen the development, what is happening in Gujarat and all over India because of the strong support of the Ayush ministry. Because the separate ministry, the concept of separate ministry, and itself is really a different concept by our Prime Minister. So thanks to the Prime Minister, his vision, and also thanks to the ministry for initiating a lot of research initiatives and educational initiatives for the betterment of Ayurveda and traditional medicine in general. Thank you.
Devanji, now we have our last speaker, Sri Rajiv Vasudevanji. And Rajiv Vasudevanji, he is an eminent speaker. Not only that, he is an IIM alumni, and he is an entrepreneur, as I mentioned. So maybe we will listen from him and another perspective of holistic healthcare, how he is thinking, how he is implementing that in his setups. So precision Ayurveda and integrative medicine is his topic. So Rajivji,
thank you very much, respected chair and my esteemed co-panelists. And I would like to begin by thanking the Department of Health and Family Welfare Gujarat for inviting me to be part of this deliberations. I hope I can contribute to the larger policy thought process in the state. So the topic assigned to me is the role of precision Ayurveda and integrative medicine, right? And in the allotted 15 minutes, 12 to 15 minutes, I'll speed through and then await questions after that. So if you look at the agenda, I'm going to talk about the context in which we need to look at policy making. What is the role of, what is precision Ayurveda, integrative medicine? How does it lead to definition of a vision for Gujarat, right? Is it possible to add to that vision, the health vision? So the first slide coincides or is derived from something which Ms. Phyllis also did say, but the takeaway essentially is that you can see the disease burden in India has come down to that extent. But globally, one feature is while the number of dailies has plateaued, right? While the longevity has increased, but the improvements in Delhi is plateauing or reversing, notwithstanding the fact that people are living longer, which means you go to Japan, people would live to 90 or 85, but today they're not as healthy as they were earlier, right? So just living long is not sufficient. You have to live long, and that's the entire concept of Ayurveda, right? The knowledge of fulfilling your complete or self-actualizing your potential, not only in terms of longevity, but in terms of your self-actualization potential. So when you look at true holistic health, I just want to say, and we should understand, Ayurveda is the ultimate systems thinking applied to health. And this picture represents that. It talks about every human being being buffeted by stressors from the environment, whether it be physical, mental, spiritual, right? You may say under mental, you might bring in emotional as well. So if I look at that, we have to understand it's like being on a tightrope walking, particularly in today's environment. And why I want to stress, and Ms. Neelam, I want to say it's not just Chinese medicine, but man and environment was posited originally by Ayurveda, and it is the mother system of medicine. Forget about calling it an alternate system. It is absolutely a joke because it stems from ignorance to call it an alternate system, because it is the mother system of medicine of the world. And even to the extent there are historians who say the Greeks, many of the things which went from here, and I don't want to get into a longer deliberation on that, but we should understand that the concepts are timeless. Principles are universal in application. Now, when you look at this particular thing, the concept of homeostasis, which is as recent in modern medicine as 1876 or so, is being posited in Ayurveda 2.5 millennia back. So we'll understand how does this play out in practice. So the oft-quoted definition of good health by the WHO, which dates back to the 1976 period, goes back to 600 BC, where I talk not about disease as the absence of disease, but the presence of positive parameters. Good sleep, good digestion, good bowel movement, good micturition, a calm state of mind. And as I tell here, clarity of senses, being alert. When you wake up in the morning, am I optimistic about life? So this is captured in a very precise shloka, right? You don't need to go back and say. So the whole thing about a healthy person is defined in positive terms. And I have played with that shloka to add good sleep and no pain to it. But otherwise, each of those things are there in the definition of Ayurveda as good health. So how does it achieve it? And we need to understand that holistic health, we need to look at it in 2 or 3 ways. It's not only physical, mental, spiritual, but also the approaches to health. So I was so happy to see Ms. Kim's slide. I'm taking advantage of his slide of social and behavioral characteristics. Not only bad habits, but the presence of good habits. What is the dinacharya? What is the ritucharya? What to do when? Today we are forgetting all of that, and we are trying to follow what is good for Italians is good for Italians. If I eat olive oil, it is not good for me. A Gujarati eating what is good for a Bengali or what is good for a Punjabi. It is not one size fits all. We're all a nation of multiple, people of different body types, metabolic types, food habits, seasons, and you can't have a one size fits all. So what this tells you, the most personalized and complete approach of ahara, vihara, vichara, aushadha, kriya. One or more. If you catch a disease at an early stage, prevention, only appropriate diet, lifestyle. Today with the burden of mental health being so much, stress, focus on these 3. That's the social behavioral change that we should focus. Medicine where required, gentle medicine, herbal medicine, and where required, deep system cleansing therapies, which restores that homeostasis. And the fact that Ayurveda today plays a clearly complementary role. They don't compete, there's no need to compete. In fact, it is a Brahmastra, I say, for countries like India to reposition healthcare itself, healthcare systems. Let's not reduce it to a wellness massage kind of thing. It is a complete health system which is able to complement in every area other than emergency medicine. Pre-acute and subacute, post-acute, right? And as we'll understand, in all the mainstream conditions. Let me assure you, if any condition is mentioned here today, all the major Ayurveda institutions in the country are treating patients very effectively in these areas, right? We'll go to evidence as we go along. It's also important when we look at health that disease progression, right? when you take a country like India, 7 to 10 years prior to being diagnosed with diabetes, my insulin resistance has already peaked. But if I just go and measure my blood sugar, I'll be told I'm okay. But I'm already, the problem has set in. What Ayurveda does, as I can share this here, is that in that golden window of opportunity, figures out emerging risk factors, what we call the Manda Agni symptoms, the Agni going down, the Ama going up. All of this is posited in clearly depicted lakshanas, or the signs and symptoms depicted in the body. So we are able to pick that up and then catch it early. So this is one of the very powerful tools actually for India to effect what we call primary prevention, secondary prevention. So as we go in here, we have another facet to remember. This single cause, single effect, symptom-based approach that we take, we forget most people today suffer from multiple comorbidities. So my colleague, the gentleman from the US will agree, 76% of the Medicare bill goes to people with 5 or more chronic diseases, right? And we're talking about treating one disease or the other. We have to say reality is this. Even in India, we're going to get to this scenario. So we need a system which takes care of the person as a whole. That is holistic health. The fact that Ayurveda, and I would respectfully differ from respected Professor Jaydevan, there are many institutions today which practice extremely documented, thorough, protocol-based care. What I'm trying to show here in diabetes care, 3 patients, all in the 10% plus HbA1c level. The disease tree, personalized disease health tree, is different for all 3 of them. The factors which led them to have hyperglycemia, right, or increased sugar in the blood is not the same. You have to treat them. Ayurveda posits a way to reverse the disease pathology tree right to the etiology. So reverse the etiopathogenesis. Ayurveda gives actually the most mature system of approach to treatment of serious diseases in the world. And one day, it will be shown. I have 5 minutes, so I'm going to rush through. So the thing is that diabetes clinical outcomes at a mass level, you can see the level of outcomes that we are able to achieve. 100 mg per 92 mg per DL reduction for people with FBS about 200 mg. 2.2% reduction in HbA1c across a sample size of 49 people. So when you look at integrative medical care, we have to understand there are a lot of confusions about what this stands for. Integrative medical care is specialists from 2 systems of medicine working together in the best interest of the patient, right? Depending on the stage, each specialist, it's not mixopathy. It's not one doctor doing both. It is about people collaborating in the best interest. So this can go as an adjuvant therapy. It can go in palliation and rehabilitation. It can go into what is called therapeutic wellness and in promotive health. So as I'll show you, the best of both worlds in the best interest of the patient. So take this as an example. Stroke patient, first phase neurosurgery, next phase neurosurgery and physiatry. Third stage, physiatry and Ayurveda comes in. Ayurveda for functional health improvement. Fourth stage, Ayurveda becomes primary, neurosurgery and physiatry become. These are real cases that we treat today in our partner hospitals. So if you look at this, clinical outcomes very systematically derived, objective parameters where possible, international outcome scales, all of this can be applied. Nothing precludes the use of very standard objective measures in Ayurveda. And the fact, so these are all scales. In the interest of time, I'll quit. Integrated medicine, examples here being done today in oncology, in neurology, in nephrology, right? Just today we got a case of 8% or 9% serum creatinine down to 4% in about 3 weeks' time, right? In Aster CMI. So through Ayurveda medication, where the nephrologist and the Ayurveda doctor work together. So this is a very important slide. I'm coming towards the conclusion of my presentation. We have so focused on primary, secondary, tertiary, quaternary healthcare, which are different ways to go and do hard interventions with a person. Let's look at truly in the preventive healthcare lens, where holistic healthcare at a community level can be imagined. We have to begin with primal prevention, the health of an expectant mother, so that the child yet to be born. Look at the state of affairs. Today, most of the states in India are plateauing in terms of the Niti Aayog's health performance index, right? If you take Take the states which have leapfrogged. Today, Gujarat is at number 6. It was in the 4, 5, 6 rank earlier. But you see, the improvement in performance can happen only if we are able to tackle primal prevention, primary prevention, secondary prevention. So if I have an expectant mother, if I don't tackle the gestational diabetes, other issues, metabolic issues, I'm creating future generations of under-potential Indians, right? So that is where Ayurveda can play a very important role. Number 2, primal prevention. Apart from looking at clean water health and other things, clean water, mosquitoes, etc., Ayurveda can come in with a very positive regimen for underweight children. You can look at the diet lifestyle which is conducive for these people. But secondary prevention and tertiary prevention is where Ayurveda will be truly marvelous in complementing modern medicine. 2/3 of healthcare demand today, and this is Government of India data, right? 2/3 of Indians die because of a chronic disease, non-communicable disease, not due to an acute emergency care. So single-minded obsession on just tertiary, quaternary care is making us miss the true picture. I want to suggest the state of Gujarat has done a fantastic job. I was so impressed today, right? Not just the pharma sector, 32% of national manufacturing, you contribute 28% of exports. Amazing performance. I mean, I was just mind-blowing. It was mind-blowing. But please remember that where will the next change? And dialysis, the kind of number of dialysis points that you created is amazing. I think it's very important to see where do we achieve that next jump, quantum leap in healthcare indices. Final 2 points here, that medical value travel, right? The people who come to India are not many from the developed countries, OECD countries. Those who come to India, they come for Ayurveda and yoga, right? The data might tell you that, you can see here, that Ayurveda is at number 5 ranking for non-resident Indians in terms of the reason that they come. This is based on visa data with the Government of India. This is published data, right? So they're not coming for modern medicine. So NRIs, Gujarat has got such a huge diaspora. How do you reach out to them and tell that this is an Ayurveda destination, right? Also, Kerala, for example, right? 30% they state, I think it's even more, people from OECD countries come for Ayurveda and yoga. So the Ayurveda marketplace is very rich. You got products, services as an industry-led, growth-led state. There is a variety of services across curative, preventive, promotive, integrative, resorts, leisure, wellness, etc. And the fact that the Government of India, right, very ably led by the Rajesh Kotecha ji in the last 5 years and more, has ensured an ecosystem which has really come in. NABH is there, ISO standards for various areas has come there, appropriate integration is more and more welcomed by industry today, straddles disease management and well-being, insurance is approving, private medical insurance, IRDA, etc. Just 1 more minute. And talent pool, 40,000 doctors coming out every year. So this is a situation, research has been really supported, enabling government regulations. So we have a situation, the market is ready, the people are asking, right? Policymakers need to step forward and say, let's do the next step to make the supply of Ayush to the people more and more accessible. Entrepreneurship, Gujarat is a state of entrepreneurs. You create that small enabling environment in the state, whether it is giving capital to Ayush doctors to set up clinics and hospitals, accessing through state government, cover Ayurveda. Uttarakhand today covers Ayurveda under their state government scheme. So these are the things that you'll do. Today, railways, defense are covering it. So through this approaches, many more entrepreneurs, doctor entrepreneurs will come. Huge employment opportunity, both within the state and for the world. Ayurveda is a high-touch business, high-touch in 2 ways, right? High-touch in physical, high-touch in emotional. And that is what today, I would say, most of modern types of services is lacking. It is very, very transactional, right? Operation Kya Niklo. Here we are able to bring the balance part. So I think we are able to complement this. And to sum up, globally, NCDs and chronic disease predominate. Ayurveda has got a huge role to play. Ayushman Bharat sooner than later will cover Ayurveda. That's our fervent hope. It is going to open up employment opportunities. There is going to be not just for disease, but for well-being, there will be different opportunities. corporates are going in, and Ayurveda and yoga can address the health need gap very effectively. Huge employment potential right across this thing. My last slide, there is a vision for Gujarat and through Ayurveda. It is very clear with the demand, with the institutes of national importance in Jamnagar, Gujarat Ayurveda University, the only one in the country. You're looking at the scientific foundation through the Global Center for Traditional Medicine. The entire traditional medicine sector of the world today has headquartered. The intelligence is sitting right here in Gujarat. How does Gujarat leverage that, right? We can't just sit with the jewel in the backyard and ignore it. And the fact that extremely good quality colleges, I don't know if you're aware, but apart from Jamnagar, the Ahmedabad College, the Baroda College, the Surat, each of them produce Nadiad College, very good Ayurveda doctors. They should all be deployed to serve the people of this state. Ayurveda and yoga complete the healthcare value proposition, high value proposition, curative, preventive, promotive, as well as well-being. Leverage Ayurveda to serve citizens of Gujarat, India, and the world, and position Gujarat as a healthcare destination. The Heal in India program, announced by the Honorable Prime Minister to make India a healthcare destination, Gujarat is very well poised to be that destination. It needs to take that commitment to Ayush and leverage all its strengths. Through that, health for everyone, everywhere, and at all times will be achieved. Thank you very much. These are the hospitals. I just want to tell you that we run. These are all NABH accredited and various recognitions right from Harvard to JCI, NABH, etc. Thank you very much.
Thank you, Rajiv ji. So, I am sure that the august audience must have enjoyed the most valuable talks by all four authors. They have delivered from all different perspectives of healthcare delivery, particularly holistic health. So I am fascinated to chair this session and then to be seated with these, very highly valued and accomplished experts. So we have few minutes. We can, if the audience wanted to raise some questions, they are welcome. We can take few questions, and then I will sum up the session. I think if we have started 15-20 minutes late, so we can stay to 15-20 minutes more. Not from now. We have started at 5:04, so I will finish at 5:35. Is it okay? Okay. So please, mic पहुंचाइए वहाँ.
My name is Dr. Pradeep Kansagra. I'm from Rajkot. I graduated from BJ Medical College 50 years ago. I did my yoga therapist course from S. Vyasa and Dr. Nagendra ji, you might be knowing. And we have a kidney institute in Rajkot, BT Savani Kidney Hospital. Dr. Kotecha, sir, you may be aware of this hospital. We have 75,000 patients outdoor every year. We do 35,000 dialysis. My question and my request is to the government whether we can take benefit of this for research. Government should not request but order these kind of the institutes, because government has given us 3 acres of land. I served as a chairman in this institute, and it was my dream project. Now I live in USA for last 2 years. And good news is that I could cure my diabetes and hypertension with holistic approach. And we both are promoting this holistic approach in USA. So can we request all these institutes like our Kidney Institute plus this in civil hospital, there is a very good kidney hospital. And Nadiad, why these dialysis patients are so many, let us have some statistics. Then only this new generation, they will agree with our Ayurveda, which is an excellent therapy. It is rightly said, it is a complementary, not an alternative. We also promote there as a complementary therapy. So this is my request. Thank you very much.
Thank you, sir. Just to, first of all, thank you for this wonderful offer. let me extend some very important few information, from the government side, that recently Ayush and ICMR both they came out with this offer to the entrepreneurs, medical colleges, hospitals for an opportunity of Ayush ICMR Advanced Center for Integrative Health Research. So this offer is open, and please take advantage of this, having an Ayush ICMR Integrative Research Center at your facility. This is one. Second, that recently Government of India has both of the Ministry of Ayush and Ministry of Health and Family Welfare, they sat together and evolved with, and decided to start an academic department in all new AIIMS. So earlier it was decided that there will be an service delivery facility of Ayush in AIIMS, but is not now limited to service delivery, but they will have integrated department of academic and research in all AIIMS. So this is a kind of very new development, and it also, is a pathway of having such kind of integration what Rajiv ji was suggesting. And third and last thing is that it is believed that this sector is nascent, and I'm seeing a lot of entrepreneurs sitting here. The giants of pharmaceutical sector are sitting here. So from government, I want to lure them. See, my agenda is very much clear that this sector is the size is somewhere between 400,000 and 450,000 crore rupee. So it's not small. It's not small anymore. As compared to 2014 study of CII, the sector size of manufacturing was only $3 billion. And as per the projection, as per the study of RIS done in 2021, it was 6 times in 2020, like $18 billion. And now, as per the projection in 2023, it is $24 billion. So from 3 billion to 24 billion is like 8 times in 9 years. So it's no more a nascent sector. So this is, please consider looking into this, not only a complementary model of evolving with a complementary model in your facility, both in service and in manufacturing, both, there is a huge scope. After COVID, there is a huge demand globally, huge acceptance, and now we are actually a leader in traditional medicine. We have been able to have a group of traditional medicine, an informal group at Geneva, where 39 countries came on board to join under India's leadership of this traditional medicine, kind of propagation and mainstreaming. So there is a lot going on, and Dr. Saab, please come forward, and we are happy to have you on board. Thank you. Anybody else, please?
Yes.
Ha, Saib.
Same, I'm Kanti Balani, OBGYN, but what I wanted to say, and it has been brought up very openly about the drug use and alcohol use, and I also have done alternate medicine and addiction medicine. So what I look at it here, that particular programs, which is known as de-addiction program, it's only 3 to 5 days acute care. Rest of the time, it is all integrative medicine, holistic medicine, spiritual medicine, whatever way you want to say. And, Western country charging $30,000 to $40,000 a month, I think we can just do it the same thing here, and how to promote and how we can take advantage of integrative Ayurveda medicine or holistic approach to the addiction or de-addiction program. And I would be happy to work as a liaison between whatever the programs we decide, and also helping recovered people who become the guideline to the other people, which is known as peer recovery support program, which you need to do, which can give a job to a lot of people who are unfortunate, who has fallen into that crack. Thank you.
Sir, I'm happy to share that there is a like a thought synchronization that last week only, just last week, I had a detailed meeting with the Secretary, Social Justice and Empowerment Ministry, and they are the by this Line Ministry of De-addiction program. So we have committed to each other that we will have this integration and then Ayush intervention. We will create modules, we'll standardize, we'll do large-scale research, and then having implemented, in next few months. So it is already, last week only we have decided. So this is something very good that I am happy to share with you. Now we can take 2 more questions, other than you, sir.
Yeah, I'll be happy to share all the protocols and
Please.
all the guidelines which
Sir.
we already have formed for last 10 years.
Immediately after this meeting, I would like to meet
Thank you, sir.
And we have 2 more questions, scope of 2 more questions.
See, I'm Dr. Jayachandran from Kerala, practicing in Gujarat, in Ahmedabad. See, we have got very wonderful crafted theoretical Ayurveda and very diagnostic-based, realistic treatment base. How we can able to merge these 2 entities as per the modern demand, one. And second one, instead of giving alternative medicine, it is better to pronounce as practicing medicine. And Ayurveda has to go for a practicing medicine. So instead of mentioning into alternative or theoretical, I think it just limits the caliber of Ayurveda in a very true positive sense.
2 things I want to mention. Actually, I am happy that all the questions are coming to me.